everyone, my name is Pranavi Oduru, and today I will be discussing on my research topic, the impact of obstructive sleep apnea on atrial fibrillation, specifically in the elderly. So to start off a little bit about myself, I'm a rising senior at Northwood High School located in California. My intended major is medicine. I'm currently a volunteer as blood donor ambassador at the American Red Cross and also an intern at the Children's Hospital of Orange County this summer. I've conducted this research before as part of the UCI Summer Research Internship my sophomore year. My hobbies are tennis, singing, as well as making my own song. So now an introduction to sleep apnea and atrial fibrillation. So obstructive sleep apnea, or OSA, occurs when the muscles supporting the soft tissues in the throat temporarily relax, causing the airways to close. So as we see in the figure to the right, a person with normal breathing during sleep has open airways and is able to inhale as normal, whereas a patient with obstructive sleep apnea actually has blocked airways, restricting the flow of air and not allowing them to inhale. What I found fascinating about this condition is the fact that people with obstructive sleep apnea actually completely stop breathing at times during their sleep, and they actually don't realize this either. So I really wanted to research further on this topic. In addition, atrial fibrillation is a type of arrhythmia, which is essentially the irregular beating of the heart, and it causes difficulty in breathing. So as we see in the figure again to the right, a normal breathing pattern looks as so, whereas with atrial fibrillation, it's a more irregular pattern. Unfortunately, there are 158,000 deaths each year in the US alone from this condition. So now OSA and AF both relate to this idea of global health, since they both still require effective screening methods and further research to develop better treatments. In addition, they affect the elderly population, as I will talk about further in the slides. But it's not just the elderly population in one country like the US, rather it's globally. So it's a global situation that still needs to be further researched. So now my research question is, to what extent does obstructive sleep apnea impact the risk of developing atrial fibrillation in the elderly, specifically ages 65 and above? So through my systematic review, specifically my narrative synthesis, I found that there is indeed a positive correlation between OSA patients and their risk for atrial fibrillation. In fact, according to an article written by Chaturvedi and Landano, there is such a strong relation that the correlation could actually be causal. So in other words, forced inspiration from OSA patients, which is caused by their need to take a deep breath, can actually lead to cardiac overload, which predisposes one of atrial fibrillation. So for this reason, OSA patients are actually at a 4 times higher risk for atrial fibrillation. Now, specifically focusing on the demographic of the elderly are more susceptible to OSA because of age-related changes. Specifically, their airways are more collapsible, their body is weaker than what it was during their middle age. And for this reason, prevalence of OSA in older patients is actually 2 to 3 times higher than middle-aged adults. And unfortunately, elderly patients with moderate to severe OSA actually tend to be asymptomatic. So it's hard for physicians to determine if one has OSA earlier on, and it's hard to take steps to prevent the OSA from developing into atrial fibrillation. So that's something that still needs to be researched further. So now a specific study of interest that I wanted to focus on is this cross-sectional study conducted between 2015 to 2017 on elderly in China with OSA. So this is the data that was reported. And what we can see from this graph is that on the x-axis, we have the different demographics of patients with OSA. So males, females, ages 60 to 70 and 71 to 96. And on the y-axis, we see the prevalence of atrial fibrillation. So what we can tell from this graph is that ages 71 to 96 actually have the highest prevalence of atrial fibrillation, in fact, 14.9%. And so this supports the idea that prevalence of atrial fibrillation in OSA patients actually increases with age. And this is also supported by the data value itself, the p-value, and the fact that the p-value was less than 0.05 allows us to reject the null hypothesis, which is that there may be no correlation or relationship between OSA and atrial fibrillation. So that can actually be rejected, thus suggesting that there is indeed a strong positive correlating relationship between OSA and atrial fibrillation, and in fact, a four-fold higher risk for OSA patients to develop atrial fibrillation. So now to the research-based answer. So my answer to my research question is that yes, to a large extent, age, specifically being an elderly patient with OSA, does indeed contribute to atrial fibrillation development. However, there's still much we need to do in a future direction. So as I had mentioned before, many of the patients are asymptomatic for OSA, so it's hard for physicians to tackle any steps that would prevent OSA from developing into atrial fibrillation. So we still need to solve the problem of coming up with effective screening techniques and researching further on better treatment options for stopping OSA earlier on. During my research, I also noticed that obesity is another prevalent factor that contributes to OSA. So even children of younger age, young adults are developing this OSA because they are obese. And so another thing we can look into is implementing healthy behaviors so that obesity doesn't lead to OSA, which can eventually lead to atrial fibrillation, which is a really serious condition. So these are the references I used for my research. And I would like to thank Dr. Andrea Nicholas, under whose program I conducted research last summer, as well as my mentor, Roseanne. And finally, I would like to thank the Global Health Leaders Conference at Johns Hopkins University for this opportunity of speaking. Thank you so much for all your time. Thank you.